Well, thank you so much for inviting me to share a little bit of my story today. I, first of all, must admit that I think in all of my years as a patient advocate, I have been in policy meetings, working to get resolutions accepted, capacity building, raising awareness. But sharing my personal story, I think that's the fourth time I've done, so bear with me. Also, we only have 5 minutes, so I guess you only get the trailer, not the full movie. But I do hope that I get to convey some points for you today. I guess my story starts with the first time I see my dad cry. So you see, I must have been 14 years old, and I come from Brazil. And back then, especially back then, there was this macho culture, like a men don't cry type of culture. So I remember that moment very vividly. And the reason why he was crying was that my grandmother, who had been living with hepatitis B and had cirrhosis, didn't recognize him. So her liver was so impaired that it wasn't filtering the toxins, and that was affecting her brain. And I do struggle a little bit at this point, because now can you imagine looking at your mom and she doesn't know who you are? And also because the second time I've ever seen my dad cry was at her funeral a few months after that. Now, fast forward to when I'm around 22, I'm no longer in Brazil, I'm now studying in England. And all of a sudden I start itching like a dog with fleas. I wouldn't stop itching, and it was very bizarre. So after a few back and forth trips to the doctor, I get this punch in the face, this diagnosis of not hepatitis B, but hepatitis C. And that was very weird. I cannot explain, because I had no risk factors. No blood transfusions, no drug use, no tattoos, no nothing, absolutely nothing. And yet, there it was. It was incredibly scary, because all of a sudden, much like what had happened with my grandmother, I had a disease, I had a virus that was beating my liver day in, day out. And back then, again, treatment options were not very great for hepatitis, especially for the type of virus that I had. We were talking about 1 year of a very, very hard to take treatment, injections, pills, horrible side effects, for less than 50% chance of getting rid of this thing. So I waited a little bit, but eventually I decided to roll that dice. I decided to try it. And the reason why I did that was because my liver wasn't getting any better. There was disease progression. I didn't want to be infectious anymore. And principally because I did not want to have any risks, even though it may be small, to passing that on to future children. So the result was that I had a year of horror, absolutely horrible. And here, I'm going to share that with you. I still have that last injection of Pegasus, of interferon. Don't ask me why I keep this. Maybe this is a topic for, a therapist one day in the future. I still have this thing. And a few weeks after I finished this treatment, this year of hell, the virus was back. It didn't work. I eventually did get my cure with the new drugs that Anton just mentioned. Bish, bash, bosh, easy peasy, no side effects. And I can't describe the feeling of weight that comes off your shoulders. Because you see, from the moment that first treatment didn't work for me, to the moment that I get eventually the cure, I did get pregnant. And I had liver issues during my pregnancy. I'm not going to get there. It's another topic there, but it was very scary. It was not fun. And aside from it all, I cannot tell you, and I cannot ever forget the tension, the anxiety, the fear of having to test a baby. and then to wait for that phone call and to be able to say, have I passed this horrible thing? And so I'm going to stop here. I think I am at the 5-minute mark, and I just want to shift gears just a little bit, just for the last bit of this testimonial, because since I stepped down as CEO of the World Hepatitis Alliance, I have been working as a consultant in other disease areas, sepsis, cancer, rare diseases, and while I really hate to put diseases next to each other and compare, here we have a situation, and we've heard that before, where there are national, regional, international commitments to eliminate the viruses. We have the tools, cost-effective. I'm not going to go there again. We've heard it many times. We have strong community members on the ground ready to help. We have case studies of successful interventions that are being done in different countries. So this is a sustainable development goal that we can achieve, and yet we are far from where we should be right now. Point is, very simple, people should not be suffering, should not be dying of preventable, treatable, or curable diseases. This is easy maths, right? So we need investments. I hope we do get the investments. And I just would like to end with that call to action for all of you to join us in this road as we try to change the story of viral hepatitis. Thank you very much.